first thank the organizers of this meeting for inviting me to talk to you about two of my devices that are currently awaiting patent related to the management or the non-surgical management of pelvic floor dysfunction. The aim of the study is to introduce the clinical need for improved adaptable pelvic organ and vault support solutions. We present the design, the rationale, and innovation behind the HPPOSS and the HPVSD systems. We'll demonstrate how the devices function mechanically and anatomically using real-world clinical scenarios. We'll highlight expected patients' benefits, including comfort, safety, autonomy, and ease of insertion and removal. Will stimulate clinical interest and discussion around the future applications, research collaborations, and adoption pathways. Just a while. The objectives of this talk will be to describe the structural features of each device, including the modular components, inflatable mechanisms, and inflatable mechanisms of both the tulip-shaped and the acorn-shaped devices. We explain how the devices address limitations of conventional pessaries and vault support methods. We'll provide evidence-based considerations for patient selection, indications, potential contraindications. We'll review the insertion, deployment, removal, and care protocols for safe and effective clinical use, and will enable clinicians to evaluate the potential impact of the HPPOSS and the HPVSD on patient outcomes and pelvic floor practice. So let's dive in. The HPPOSS and the HPVSD solutions for pelvic organ prolapse. Pelvic organ prolapse remains a prevalent and distressing condition affecting nearly 50% of Paris women over the course of their lives. Non-surgical management with vaginal pessaries play an integral or critical role in the management of pelvic floor dysfunction. It finds utility in patients who are unfit for surgery, who are awaiting procedures, or who prefer conservative treatment over surgical intervention. However, the conventional pessaries often fall short due to issues of retention, discomfort, hygiene, obstruction to urinary outflow, and self-management. So let's just reflect for a minute. We have traditional pessaries which have been in use for some time. We have also seen the advent of minimal surgical procedures to address specific elements of pelvic floor dysfunction. I speak specifically of genuine stress incontinence. So obviously, if those facilities have been in use for some time, there may be, or there should be, some benefit to the use. But we have also found that there are some complications. Among the complications, we talk about erosion, protrusion, pain, infection, and damage to adjacent organs. So for a minute, let's see if we can take the goodies or the positive uses of these forerunners, amalgamate them into a single device, which eliminates the complications or the not so good features associated with those devices. If you're interested in knowing more, let's dive in. So the HPPOSS introduces the Harris Phillip pelvic organ support system. This is a next generation tulip-shaped intravaginal pessary designed to provide dynamic and anatomically responsive anatomically responsive support for anterior, posterior, and apical prolapse, thus offering general support to the pelvic floor by mirroring the two upper levels of physiological vaginal support. The two upper levels we talk about are the apical level of support and the lateral levels of support. The HPPOSS features an expandable balloon core mechanism activated by a user-controlled inflation system. It has upwardly flared petals that cradle the cervix while physiologically restoring vaginal access support. On the surface interface with the vaginal walls are microbubbles engineered to enhance lift, retention, and evenness in pressure distribution. At the base of the petals are integrated drainage apertures, which ensures fluid egress. A retrieval loop facilitates patient-led removal. It is constructed from high biocompatibility silicone or grade 6 silicone or fluorosilicone to minimize microplastic exposure and maximize patient safety. The HPPOSS represents a significant innovation in user-friendly prolapse care. Initial 3D models and anatomical simulations suggest strong promise for clinical efficacy, patient autonomy, and adherence, while the use of air to inflate the petals of the device mirrors the trampolining effect offered by the native pelvic floor as it adapts to physiological changes in intra-abdominal pressure. The HPVSD, or the Harris Phillip Vault Support Device, is like the HPPOSS, but its use is reserved for individuals experiencing vault prolapse after hysterectomy. The acorn shape with reduced petal reach is the singular difference. So the only difference between the HPPOSS and the HPVSD is the acorn shape in the HPVSD and the reduced reach of the surrounding petals. So it does the HPPOSS has a hollow central cavity which cradles the cervix, whilst the HPVSD has a protuberance, if you will, that snugly fits against the vault apex, lifting it into its more physiological location. Then let's talk about the general features of the devices. The general features involve a tulip-shaped pessary which has 4 upwardly flaring petal lobes. It is inserted in a collapsed state. It expands or blooms once in place and inflated. This device measures about 5 centimeters in length, and when it's inflated, it measures about 4 centimeters. Now you may be wondering about the size or the dimensions mentioned. They equate to a regular size tampon, and when it's fully expanded, it represents or relates quite closely to a fully soaked tampon. In the collapsed state, that's prior to insertion, the device measures about 15 to 20 millimeters in diameter. That's about 1.5 to 2 centimeters in diameter. We continue to talk about the general features. It has a self-removable loop at the base, and there's an inflation mechanism which allows one to expand the device once it's inserted. That mechanical loop also is associated with the ability for the user to deflate it prior to its removal. At the base of those petals are small holes or drainage apertures, which allows for fluid, whatever secretions are produced in the vagina, to be passed out through these drainage apertures. On the surface of the device, which is in conjunction or against the vaginal wall, are some micro bubbles, which help to hold the device in place while ensuring there's an equitable pressure distribution throughout the area of contact. In the device itself is an internal bladder structure, which is visible via transparent cutaway when you're rendering it. The material is made of medical grade silicone or fluorosilicone rubber, which simulates flexibility and reduce microplastic exposure. The anterior petal has a unique feature for urethral protection whilst addressing urinary incontinence. This unique feature is delivered in 4 different iterations, strategically delivered to alleviate the risk of urethral compression and subsequent urinary obstruction whilst addressing stress urinary leakage. This modification directly addresses a critical concern in existing devices, offering patients improved urinary function and enhanced comfort. Additionally, on the outside of this device, we have a hydrophilic polymer coating. The coating enhances lubricity facilitating easier insertion and removal while minimizing friction-related discomfort. This innovative feature improves patient adherence and reduces the risk of tissue irritation or injury during use. We continue to talk about unique features. We talk about the drainage perforations, which lie at the base of the petals to allow for easy fluid egress, thus addressing hygiene as well as reducing the risk of infection. The upwardly directed micro bubbles are strategically placed on the outer petal to create a buoyant lift, enhancing the device's positional stability within the vagina. The petals are activated by inflating them with air. This feature provides dynamic support of the pelvic organs, adapting to changes in intra-abdominal pressure, such as patient movement, coughing, sneezing, laughing, and such alike, thus delivering superior therapeutic efficacy by mirroring the trampolining effect of the native pelvic floor. Now you may wonder, after all this, is there really a need for this device? We face an aging population. As women live longer, the incidence of pelvic floor disorder increases, creating a larger patient pool. Patients, as they get older, or even just regular life, prefer less invasive options due to the low risk, faster recovery times, and avoidance of surgery. Additionally, some of our forerunners have been dampened, or the enthusiasm of their use have been dampened because of safety concerns. Past safety issues and FDA warnings regarding surgical mesh implants have contributed to a greater interest in non-surgical options like pessaries. For example, in the TVT and TOT, which are minimal invasive therapeutic options for stress incontinence, although there's a 75% cure rate after 25 years, because of the complications that are associated with the use of this device, there is a warning about their use. So if we could get a device that features all the benefits of those forerunners without the necessary complications, of course, that should be a recommended portal to follow. Additionally, for devices, we have innovations which have led to better outcomes and higher patient satisfaction. We have also been able to, or we are working currently on developing a smart mobile app with these wearable devices, linking them to telemedicine. And linking them to telemedicine, we enable improved self-management and remote monitoring. What's the market relevance to this? With pelvic organ prolapse affecting millions of women globally, the HPVSD and the HPPOSS address a critical need for safer, more effective, and patient-friendly devices. The innovations embodied in these devices provide a compelling value proposition to healthcare providers and patients alike, offering significant market potential in the rapidly growing field of women's health solution. In fact, it is estimated that over 50% of our female population can expect to have some element of pelvic floor dysfunction during their lifetime. Hence, these devices could not be a more required instrument for the management of pelvic floor dysfunction. These devices are going to be marketed in 3 different sizes. We talk about small, medium, and large, and there are guidelines as to who should use a small, a medium, or a large. So with these devices, we are confident that we will not only return autonomy to our mothers, aunts, sisters, wives, and daughters, but we will provide a comfortable daytime device which is both private and does what it says on the tin. Now we have a look at schematic as to what these devices look like. This device is the HPVSD. We spoke about the acorn shape here and the reduced reach of the petals, as can be seen here. Now, in the HPPOSS, we talk about the whole hollow tulip design, which can be seen here, and these little dots here are the microbubbles on the surface, which facilitates retention of position as well as enhanced lift of the pelvic floor. Prior to its insertion, the device looks something like this. Okay, And I have two short videos, less than 1 minute long, which shows you the devices in operation. So we will look at the first one here. Sorry, I'll have to stop this. Okay. So the device is being inserted. The uterus is pushed up. Device is removed. See, the urine is filling up into the bladder and the leakage is stopped. So easy insertion, easy removal. Demonstrating the hollow tulip shape design of the HPPOSS. And we look at the second one, which is the HPVSD. Oh, let's see this. Okay, so here is the vault after the removal of the uterus. You see there is some urine leakage. The device is now being inserted. It lifts the vault upwards to a more physiological position of the apex of the vault. Now, as the device is being moved upward, you see there's a narrowing of the space here, which tells you that the bladder neck is raised. And as such, the urine loss is stopped as a result of the lifting and minor compression of the bladder neck. Okay, so those are the two devices we spoke of, and a brief synopsis as to their functionality. So in conclusion, we believe our devices provide enhanced anatomical support for pelvic organs and vault through a tulip shape and acorn shape upward and flared design that more closely mimics natural tissue contours. We believe it improves patients' comfort and retention using flexible, biocompatible materials and an inflatable deployment system that adapts to individual anatomy. It simplifies clinical management with predictable insertion, secure placement, and self-removal loop that increases patient autonomy. It reduces complications associated with traditional pessaries, including pressure points, slippage, and inadequate lift by distributing support more evenly while mirroring the trampolining effect of the pelvic floor. It offers a modern modular solution suitable for a wide range of pelvic organ prolapse presentations, expanding treatment options, and supporting better long-term outcomes. Both devices have pending patents at this time. So I want to just thank the individuals listening to my presentation this morning. And here ends my presentation. I'll be happy